As Andy said, I'm one of the founding directors of the Mind and Soul Foundation, which is a think tank that's been exploring issues of Christian spirituality and mental and emotional health issues since 2006. And over that time, through personal experience of mental health, I suffer from GAD, generalized anxiety disorder, and through working with other Christians, I've noticed that without a theology of mental health, we're often all at sea in the church. But it wasn't that the church didn't have a theology for sufferers of mental health. What I realised was that Christians suffering from mental health problems were often subject to what I'd call the theology of radical unbelonging. This wasn't a biblical theology. It wasn't necessarily something that the Desert Fathers sat around considering before implementing. It was something that seemed to grow organically within the community of the church. It certainly wasn't one that was espoused by Jesus. It was built upon lots of superstition and misunderstanding around mental health. And there was, of course, a huge amount of fear involved in that too. Whilst the centuries have passed, sufferers of mental health problems were subject to physical violations of different kinds, sexual exploitation, often public humiliation for the entertainment of others. Today, sufferers often find themselves facing much more subtle forms of stigmatization, suspicion, and exclusion. And sadly, this exists within the church community as much as it does within society at large. The extent the radical theology of unbelonging continues to be espoused in contemporary Christian texts is alarming. Some suggest still that depression is a decision, anxiety is a sin, psychosis is clearly demonic, positivity is a virtue, and all mental health problems can be resolved through prayer. But a true biblical theology of mental health is, of course, far from these things. A true theology of mental health is a theology of poverty. A theology of mental health is one that acknowledges that material poverty, homelessness, exclusion, the plight of the UK's 87,000 prisoners are all inextricably linked to mental health conditions. When Jesus said in Matthew 5:3, "Blessed are the poor in spirit, for theirs is the kingdom of heaven," he meant these poor. In 1 Kings 19 verse 4, we see, if you like, the beginning of an outworking of a theology of mental health. Elijah is suicidal. He's been chased around the block by Jezebel, who's been saying all sorts of things about him. He's physically exhausted, no doubt, and he's certainly psychologically disturbed. And he cries out to God, "I've had enough, Lord. Take my life." God did not condemn Elijah. God does not exclude Elijah. God didn't punish Elijah. God didn't say that Elijah's theology was out of whack. Instead, God responds in the most godly, biopsychosocial manner you could ever anticipate. "Get up and eat, for the journey is too much for you," says God. And so we see God respond to Elijah with gentility and compassion, celebrating the whole of Elijah, not just his mental faculties, his physical ones too, his sense of exhaustion and desolation. The God of love present in the desert with the broken. And hence, a theology of mental health is an integrated biopsychosocial one that integrates mind, body, spirit, community, and family. It's one that acknowledges that Naomi, Job, David, Elijah, and Judas knew and exposed complex and sometimes disordered emotional worlds. But also that Jesus himself expressed a full range of emotions, both perceived positive and negative, what I like to describe as the purple and the yellow. As it says in Isaiah 53:3, he was a man of sorrows, familiar with sufferings. A theology of mental health sees people not as mental health problems to be fixed, but as children of God, waiting to be loved. And Jesus is found amongst the poor. Indeed, in John 10:19, he himself is called raving mad. This is what it means to be Emmanuel, God with us, God standing with others who are ridiculed and exposed. Pope John Paul II, in his important 1997 piece of work, The Image of God in the People with Mental Health, says, "Whoever suffers from mental illness always bears God's image and likeness in himself, as does every human being." So a true theology of mental health celebrates the whole person and stands with them in their suffering. It's this place of tension in the now and the not yet of the kingdom of God that good theology really exists. As Martin Luther said, if it isn't a paradox, then it's probably not God. And this was something that Spurgeon knew well. In his fierce depressions, whilst he exposed and preached through the joy and the love of God in all circumstances. And this was something that Martin Luther knew really well as he wrestled with chronic anxiety and depression, as he pinned his thesis on the door of Wittenberg to, if you like, break out a new dawn of revealed Christianity, in which we might truly connect with the one who knows us and loves us just as we are. This was something that Florence Nightingale knew really well when she loved the poor and the broken in the early hospitals and gatherings of those who were sick and outcast, whilst herself suffering with bipolar disorder, at that time undiagnosed and unsupported with any kind of medication. And this was something that John Bunyan knew really well. Whilst he was preparing to write A Pilgrim's Progress, he decided he might write about his horrific thoughts and terrors, exposing what we know now as crippling obsessive-compulsive disorder, still willing to help us to walk the pilgrim's road. And this was something that William Cowper knew really well when he was writing the Olney hymns. Following a suicide attempt, he wrote that great hymn on the 25th of April, 1800, "There is a fountain filled with blood." He says, "For since by faith I saw the stream, thy flowing wound supply, redeeming love has been my theme and shall be till I die." A theology of mental health is a theology of the victorious Christ who is suffering. The suffering Christ and the victorious Christ are one and the same. Our church will only be a valiant church if it's a suffering church. A church that does not segregate love and suffering, but loves in suffering. I commend to you, friends, a theology of good mental health. Thanks for listening.